Hello everyone and welcome again to Many Notes for Medicos, and today we are going to cover a very important university exam topic, as well as we might be viewing this or we might be observing this in most of the serious clinical cases in our near future. So the most important thing we need to learn in congestive cardiac failure about digoxin and its toxicity. So digoxin is the drug we are going to learn about today. Firstly, we would be going through the introduction, the pharmacokinetics, route of administration, mechanism of action, the side effects, and the contraindications. These are the topics that we are going to cover today, and that is sufficient for you to know about digoxin and its toxicity. The thing that you got to understand when you watch this video is when you view the books, you won't understand it when you read it without understanding the concept. So this video is purely meant for you to understand the concepts and to know how to write it in the university. So we'll be learning first about the introduction, like where do we give the digoxin drug. This is given in symptomatic patients. Now what do you understand by symptomatic? Symptomatic means the patient will start showing symptoms. So the patients that show symptoms of congestive cardiac failure are the only ones that we should prescribe digoxin. And the best part of this drug is it does not affect mortality. The next thing we'll be learning is about pharmacokinetics. The pharmacokinetics is important to know how the drug is working in our body. So what does it do? It has a very good oral absorption. It absorbs very easily in the body. It has a high distribution. So when it has a high distribution in our body, we give them a loading dose. So of any drug that has high distribution is supposed to be given a loading dose. Now how does it eliminates? It eliminates by the renal system. It has a very low therapeutic index, and that's why we need to regularly monitor it. It has plasma level that is less than 1 nanogram per milliliter. Now we'll go through the route of administration. When we see the route of administration, what do we notice first is we can give them in oral as well as IV, but we avoid IV. Why? Because it causes digoxin toxicity. Why does it causes digoxin toxicity? We have already learned in the previous slide I have shown you that this has a very low therapeutic index. So when it is having a low therapeutic index, and if we give IV, it rushes in the human body in a very rapid state that we won't be even knowing when the digoxin toxicity actually occurs, because it has a very good absorption capacity. So we would be preferring to give them in oral. In oral, we know the dose, and we would be giving them in timely intervals, and we would be understanding that yes, now digoxin toxicity might occur, and we need to give them a very good time interval to heal from it, and then give the next oral. Now we will be learning about the mechanism of the action. Mechanism of action of every drug is very important to know how a particular drug performs in a human body. So the mechanism of action of digoxin occurs in two ways. One is the cellular level and one is in the organ level. When we see cellular level itself, we understand that it would be occurring in two ways. How would we occur? It would be occurring as extracellular, that is outside the cell, or intracellular, that is inside the cell. In organ level, what it happens, it shows what does it do in normal dose as well as in high dose. Normal dose, it means if it has a chronic usage of the drug. Chronic usage means a very long time we have been using digoxin. That means we have been giving them intervals, yet the usage of digoxin has been in a very long lifespan, so it causes even in normal dose some sort of effects. So what would it be? So firstly we will be going through extracellular, then intracellular, then we'll be knowing about normal dose, and then we will be going through the high dose. Now when we go through the extracellular mode of mechanism, what did I say about extracellular? It occurs outside the cell. So now we would be assuming this to be the cell. The cell extracellular mode of mechanism, it causes the blocking of Na plus and K plus ATPase pump. So Na plus is outside, Na plus is inside, and K plus is outside the cell. So what happens? K plus go inside the cell, Na plus go outside the cell. But when this digoxin is given to the patient, it binds to the cell. Okay, it binds to the cell. It blocks the Na plus and K plus ATPase pump. So what is the role of this? The main role of this is it causes reverse depolarization. Now when the Na plus is blocked, Na plus K plus ATPase is blocked, what happens? Na plus increases inside the cell and K plus increases outside the cell. So what happens? K plus increases outside the cell. So there would be lot of K plus. K plus would be over all places over here. There would be an increase in potassium level outside the cell. When increase in potassium level occurs, it causes hyperkalemia. What it occurs? Increase K plus causes hyperkalemia. Now, when K plus has increased outside the cell, this goes and attaches to the cell, K plus. This side all this attaches to the cell. This K plus goes and attaches to itself to the cell because of hyperkalemia. When K plus attaches itself to the cell, the spaces are supposed to be filled by digoxin. If potassium wouldn't have taken place, wouldn't have been bind itself over the across the cell, the digoxin was supposed to go and bind. So if digoxin would have gone and bind itself over along with the cell wall, what happens is that along the pump, the digoxin toxicity would have occurred. But because hyperkalemia occurred over here, digoxin wasn't able to bind, because instead of its binding, the potassium came and bind itself over here. That caused the prevention of digoxin toxicity. So this is what happens in diuretics. What happens? I have already told you what happens in diuretics. Hypokalemia. I told over there that potassium increases over in extracellular. Hypokalemia means what? Hypokalemia means decrease in potassium level. When potassium level is decreasing, what is not happening? Binding of the potassium across the cell doesn't occur. No binding of the potassium is occurring across the pump in the cell. So when the binding doesn't occur, this is being occupied by digoxin, this side is occupied by digoxin. It all goes and binds to the pump. Digoxin binds itself to the pump, thereby causing what? Digoxin toxicity. So we won't be giving digoxin in the cases of diuretics. Now we'll be learning about intracellular mode of mechanism. You'll again make a cell over here. So intracellular means what? It's occurring inside the cell. So Na plus is inside the cell. Ca2 plus also is inside the cell. What is outside the cell is potassium. Okay. So for the timing, we're forgetting about potassium and we're focusing about the sodium calcium exchanger pump. What happens over here? The Na plus, it is increasing inside. When it is increasing, here exchange is not occurring. So calcium level also increases in the cell. So when calcium level increases, calcium is increasing in the cell, but it is not able to go out completely. So why? Because it might be going out, but in a very less amount. That is caused, that causes what? Delay in depolarization. Because calcium doesn't go out, and calcium is something that is responsible for the contraction. When contraction isn't occurring, depolarization delay is occurring over here. So here depolarization occurs. When depolarization occurs over here, extrasystole occurs. So extrasystole occurs. So this depolarization doesn't happen just one time. It doesn't happen just one time. It happens in a repetitive way. So when it's happening in repetitive way, what happens? Extrasystole also, extrasystole also has a repetitive tendency. When repetitive extrasystole occurs, it causes arrhythmia ventricular, two types, bigeminy and trigeminy. So what happens is, in this ventricular bigeminy is one of the most common induced occurring arrhythmia. It's occurred mostly because of some sort of drugs interaction. So this causes, then again calcium level, it goes on increasing, it's not decreasing at all. So ventricular tachycardia occurs. On further increase in the calcium level, ventricular fibrillation occurs, and ventricular fibrillation is a very life threatening case. Okay, so arrhythmia ventricular, I have already told, ventricular bigeminy is the most common induced arrhythmia. In arrhythmia ventricular trigeminy, we give them potassium so that it prevents digoxin toxicity. But when it comes to ventricular fibrillation, the drug of choice we usually prefer to give is known as drug of choice. So the drug of choice is lidocaine propanol. Why we don't give K plus over here is because when the potassium, it crosses around, when potassium, if it is given below levels of 3 millimole per liter, it causes significant increase in the QT interval prolongation with subsequent risk of torsades des pointes and ventricular fibrillation and sudden cardiac death. While potassium level, if it is above 6 millimole per liter, it causes T T waves, wider QRS complexes, and this might result in bradycardia, asystole, and it can cause to sudden death. That is the main reason we don't give K plus in the treatment of ventricular fibrillation. The next we learn about the normal dose. So in normal dose, it actually shows a parasympathomimetic effect. Mimetic means it mimics the parasympathetic effect. This causes a blocking in the SA node and the AV node. When blocking of SA node and AV node occurs, the contraction, that is Ca2 plus, increases in atrial cells. So Ca2 plus, that is calcium, is responsible for contraction of the arteries or the vessels. So it causes atrial tachycardia. So if a patient comes with you with digoxin toxicity, the signs that you can understand, digoxin induced arrhythmia, the signs that you would see in an ECG would be, you would notice the AV node blockage occurring and atrial tachycardia. Now, in such cases, what happens is, uh, we can convert it to atrial flutter. From atrial flutter, we'll convert it into atrial fibrillation because it would be less life-threatening case. That now, we would be talking about high dose. In high dose, what it does, it acts as a sympathomimetic, that is, it pushes the sympathetic effect, and this causes tachyarrhythmia. Next, we'll be knowing about the side effects. Its side effects, the first and the most common side effect that we see is about the nausea and the vomiting. It causes all types of arrhythmia except atrial flutter and Morbitz type 2 block. What is Morbitz type 2 block? In this, there is a particular problem that occurs with the infranodal conduction system. It also causes hyperkalemia. Why? Because we are giving digoxin in the case of extracellular. Uh, Mechanism of action occurs here. In that, what happens? The potassium level increases outside the cell. So it causes hyperkalemia, yellow vision, and gynecomastia. Gynecomastia means change in the sexual features of an individual. Next, we'll be learning about the contraindications. In this, I have divided into three forms, that is conditions in which we shouldn't be giving digoxin, the drugs along which combination digoxin should never be given, and in Wolff Parkinson White syndrome, why we shouldn't be giving digoxin. So we'll start with the conditions. In conditions, if a patient is having hypokalemia, we would never give digoxin. It would cause digoxin toxicity. In renal failure, we won't do it. Hypercalcemia, it might lead to ventricular fibrillation, and that would, if we give them digoxin, it would just enhance it and it would kill the patient. Hypomagnesemia we would not give. In myocardial infarction, what happens, it increases the permeability of the cell to have more Ca3 plus ions. In such form, Ca3 plus, it converts into Ca2 plus, and Ca2 plus again increases. If Ca2 plus increases, it causes ventricular fibrillation, and then the process occurs. If it is having digoxin, digoxin toxicity occurs, which would, because of the digoxin toxicity, the patient is led to death. Now we will be learning about the drugs with which combination we shouldn't be giving digoxin. If a person is having diuretics as their medications, we should never prescribe them digoxin with diuretics, with quinidine, with amiodarone, darone, propafenone, adrenergic drugs, and propanol. These drugs should never be recommended to be given along with digoxin. The last is the Wolff-Parkinson-White syndrome. In Parkinson-White syndrome, blockage of the AV node is occurring. When blockage of the AV node is occurring, it increases the conduction through the accessory pathway. When there is an increase in the conduction in the accessory pathway, it is due to what? Due to increase in the calcium level. So once the increase in the calcium level occurs, what did I say in previously also I had said that increase in the calcium level causes digoxin toxicity to occur, because it will lead to gradually ventricular fibrillation. Due to digoxin toxicity, it would lead to death of a person. So when calcium level is increasing, it increases the conduction through the accessory pathway, and when this occurs, it causes the worsening of the syndrome. So that was the video today. I hope you understood the mechanism of the action as well as the side effects and the contraindications of digoxin. We'll come with more videos that is very important for the university as well as the clinical aspects. I hope you like this video. If you like this video, don't forget to like, share, and subscribe. We'll be coming again with more good videos. Till then, bye.